Hemophilia is a X-linked inherited bleeding disorder which is either deficient or defective production of plasma clotting factors. According to that, it is divided into hemophilia A, B and C, factor 8, 9 and 11. 80% is hemophilia A, female are the carriers and male are the affected ones. Hemophilia is diagnosed by familial history. Usually families have a history of hemophilia. Second is by the clinical manifestations. Third is by the laboratory tests, in which we do the measurement of factor 8, gel electrophoresis and molecular DNA test. In clinical manifestation, hallmark is bleeding into joints, muscle and soft tissues, and the severity of bleeding is according to the activity of the factors. The management is a multidisciplinary comprehensive outlook. According to it, we have to see the preventive care. That is, we have to educate the patients about hemophilia. They have to carry alert devices that they are hemophilic. Second, they have to take vaccination of hepatitis B and C. Third, they should avoid taking aspirin and NSAIDs. Fourth, they should avoid contact sports. They should have proper dental checkups. Then we have the replacement of the factors which are deficient. Previously, they used to give cryoprecipitate and lyophilized plasma derived concentrated factor 8, prothrombin concentrations, but nowadays we are giving recombinant factor 8 and factor 9. Then we have the treatment of the complications. Like if they have acute bleeding, then we have to give the factors, plus we have to give tranexamic acid, then we have to give desmopressin, and second is we have to see any infections, if they have any infections or any joint, because of bleeding, recurrent bleeding into the joints, they may need joint replacements. Then we have they develop antibodies against the factors, so we have to give them immune tolerance therapy. And last is, nowadays we have developed gene therapy, in which we replace the missing factors. April 17th is celebrated as the World Haemophilic Day. The agenda for 2024 is Equitable Access for All, Treatment for All Bleeding Disorders. It is a call for and awareness to all the government and local policy makers that they should treat all bleeding disorders, inherited bleeding disorders, despite the gender, sex or location or what type of bleeding they have, like for example hemophilia A, B or von Willebrand's disease. And in India, we have the Indian Federation of Hemophilia, which has a mission of one country, one treatment. It has all the hemophilic patients under one umbrella, making affordable treatment and care.